كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه.
بسم الله الرحمن الرحيم. Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Salim Hussein. I'm a medical doctor. I'm an assistant director of medical services in the Ministry of Health. I'm glad that we are collaborating with Ilm TV so that we can be informing, educating our masses in terms of health. And I'm very glad that this partnership has come to fruitful. Today, we want to talk about what are the scope of healthy lifestyle. Basically, we know in Islam that we all need to be healthy, and being healthy is very important. One, because all our ibadah, we need to be healthy for us to be practicing well. We know that if one is sick or is having a condition that is incapacitating him, will not be able to undertake our ibadah. And most of our ibadah actually are very physical, and they maintain our mental aspect, they maintain our physical aspect, our spiritual aspect, and more so our social aspect. You'll see that our ibadah, one, beside our direct connection with Allah, it needs us to go and relate with our people. For example, during Salah time, we need to go to the mosque, and in the mosque we meet with the other people, we pray together, we are social, so it is a communal thing. That entails also moving from one place to another. We see ibadah like going to Hajj actually entails very physical activity. One, there's a lot of movement from one place to other. We know the Safa al Marwa. We have to move around Tawaf. We know that if you are not properly, if you are not healthy, you'll not be able to do those, and it will be more difficult. So basically, we want to look at some few areas which will actually enhance our healthy lifestyles. We know that, especially currently with the modern changes, with our current lifestyles, we have actually changed, and we are living what we used to do, which was very important for our health. For example, we know that our colleagues, the Maasais, used to walk for very long, and this used to give them health, despite that they took a lot of meat, take a lot of blood, and even milk. But you see that they do not suffer obesity. Most of them do not suffer cardiovascular diseases. So, one, we want to know the meaning of health before we go to what are healthy lifestyle. According to World Health Organization, health is a complete state of one, the physical health, the social health, how we interact with the people, with the community, the mental health, which is an area that is very neglected. Most of the time we do not talk about this. And then currently even WHO has added the spiritual health. So spiritual health is part of the well-being of a person. If somebody lacks any of these four components, especially the spiritual health, you're not in a state of well-being, and you're not a state of health. And we know that health is not just about diseases. The absence of a disease, it does not necessarily say that you are healthy. You might not have any disease, but you might have mental issues, you might have social issues, you might have economical issues, which will lead to depression, will lead to other illness in terms of social ills. So when we talk about healthy lifestyles, what do we mean? Basically, this is looking at how a person should live in a holistic manner. One, if you are healthy, how do you maintain your health? Two, how do you prevent one from getting diseases? Three, how do you promote the health already that you have? Four, if you are sick or now you have ill health, how do you get back to a normal status of health, and how do you prevent complication? And more so, what are these interactions, whether they are individual interaction between you, yourself, you and your Lord, your interactions between you and your family, your interaction between you and the society and the community. It has been shown that these interactions are very important, especially for social backup in terms of when you are sick, when you need comfort, when you need to get back into health, and you need to be integrated back into the society. So this aspect in holistic manner is what they give a healthy lifestyle. physical activity, it has been shown, is a very big component of whether people are going to get health or not. Most of us currently are just sitting a lot. We are watching TV for many hours. We are sitting in our offices for a long time. So this has reduced drastically our physical activity, which is an important element of our lives, and we'll talk about it in depth in later stages. The issue of nutrition. We know what we take actually makes what we are. Our nutrition actually is very important for our mental status, for physical activity, and for the energy that we have, so that we can be able to do things, we can be able to move, and we can also be able to concentrate in what we are doing. So nutrition is also an element of one of the scope of healthy lifestyle. The other element that is very important in healthy lifestyle is how do we get back to health? This is the issue of medical assistance when you are sick, things that you should do, what you should take, for example, medication, so that you can get back to health. So Islam really encourages people to be healthier, and you'll see that even from the pillars, it strengthens the aspect of spiritual health, so that our relation with Allah, we know what is the purpose, the inner purpose of living. And we are told in Islam that Allah has created the people, the human beings, and the jinn for only one sole purpose, to worship Him. And we know for one to worship, you'll worship better in a status of health. Issues of salah, you know that they encourage many enablers of health. One, purity. When you are pure, you know that you prevent yourself from many diseases, because sanitation is one of the most important aspects where we prevent about 60% of all our diseases. We know that when there is no sanitation, there is no good hand washing, there is no proper environment cleanliness, it causes a lot of diseases. And this is one way that we should prevent diseases. The issue of zakah actually brings about the social well-being. It enables those who do not have to be able to have, to be able to manage their lives, to be able to take care of their families, their children, and themselves. So even this brings an aspect of health in Islam. Pilgrimage actually can positively bring a lot of health in terms of putting us together, unifying us. When we go there, we do the same thing. But we also know that this is one aspect when people come together, that we can actually get many diseases. We know diseases like flu, influenza, disease of meningitis actually can really spread fast where people are coming together, like in pilgrimage. But basically, all the Islamic pillars actually are enablers to health. And also Islam emphasizes very much in terms of issues of moderation. For example, when you look at eating, Islam tells us that we should divide the stomach into 3 portions. One portion is for food, the other portion is for water, and the last we leave it for air. And this actually has been shown, research has been shown, especially in places like Japan, that many people there live because they actually follow this principle of not eating to the full, but in moderation. And it has been shown that this is actually has good effect to the body, and it maintains a good health. So we can see that most of the Islamic principles actually help us to be very healthy, so long as we are following them. And many researches have also been shown, for example, in Saum, when we are fasting, it actually enables one to rejuvenate. It enables him to overhaul his body, because when somebody is fasting, all the lining of the intestines are actually clean. The body now takes time to purify itself, and this has been shown that it actually makes the person a better person in terms of diseases, because you know most of the diseases actually has a precursor, has in what we take, the food. And also, if we take too much food, we know the issues of obesity, which are causing a lot of NCDs. We know cardiovascular diseases currently are the increase. Diabetes is on the increase. This is actually basically some of the things that can be caused by malnutrition. So the things that we are doing in Islam can actually help us to reduce these diseases. In terms of WHO, there are specific dietary requirements, for example, in food. How much of salt should we take? How much of calcium should we take per day? How much of carbohydrate? These enable us to be in good state of health and also to be able to do our things. In terms of spiritual health, we are looking at what are these connections between us and Allah. What are these things that actually you can do or hold to when you have a spiritual health so that we can be healthy. So these are some of the scope of health. These are some of the areas of health that we really like in future. We are going to talk in depth in each of them so that we can actually inform ourselves on what we should do, what we should not do, so that one, we maintain our health when we have it, we prevent further deterioration of our health when we get sick, and four, when we are third, when we are sick, how do we get back to this health and stop complication? So we really going to put across simple things that we can all do in our daily life so that we can have healthy lifestyles. And these will enable us to actually to prevent diseases, to prevent ill health. And we know these actually can be very costly. And once you get a disease or ill health, it is very difficult to get to your normal status. But what are these simple things that we can do so that we can all remain healthy, be healthy as individuals and as society? So I want briefly to look at what are some of the things, the plan, the implementation that actually we can do generally as in to have a healthy lifestyle. I think one of the most important thing for us is for us to know, do we know our purpose of life? And alhamdulillah, for us Muslim, we know our purpose for life is to worship. So what are these things that we need to do so that we can actually worship better? One, the health, your body that you have been given is an amana. And this amana, you need to take good care of it so that you do not harm it, you do not cause it to get ill health. Two, what you need to do to others so that you do not make them get ill health or make them sick. So we need to relate to people well. We need not to harm people. We need not to have interaction that actually can make people sick. And we know that about having ill health or not having health is not just about giving somebody an injury or hitting somebody. This starts from the state of the mind. That is the things that we talk to, the issues that we are discussing, whether you are backbiting somebody, which is not good. So these also things that from our thoughts to our talks to what we say actually are very important in terms of that we reduce ill health. So for us Muslims, we know we have been given guidance in terms of how do you relate to yourself, how do you relate to other people, how are you supposed to take care of your family, how do you need to interact with the society in general. So, and we know that all this, if we do them as we as expected, they actually will lead to good health. One example is just the issue of your family. If you want to start a family, we have actually been told the best thing one you look at is the religion. And you know, if you get a person, either spouse who is religious, actually will do things in moderation. He'll be a person who is God conscious, a person who will be society conscious because he knows how to relate to this person. Even before getting married, we are told that there are certain things that we need to look at. For example, is this person suitable to you? That is, do you get some satisfaction before marriage in terms of within the Islamic context, looking at this person, interacting with this person, looking at the family background. So I will extend it to we also should go a step ahead. For example, look at some genetic diseases that either one of us could be having. For example, albinism. If one partner has and the other one has, there are high chances that the children who are going to be born, they'll actually be albino. We know things like thalassemia, which is a disease of the blood going abnormal. If one partner has and the other partner has, there'll be high chances. So it will be good not to have. We know even diseases like diabetes and asthma. If it is in the family, there are high chances that there'll be transmission between the parents to the child. So Are these some of the things maybe later or will be important even in health that we can actually also consider beside what we have been told? We are told, for example, we look for a good mother for the children. This is the beginning of the health of that child, because we know the status of the mother, whether it is physical. We know that when a mother, for example, is short, is less than 155 centimeter, there are high chances that during delivery they'll have problems. So this even physical aspect of the person, the wife, the mother of your children that you want, actually can be seen from very early stages. The health status in totality, whether this person has, for example, enough blood or not, will affect that child. So this aspect of health actually starts from very early, even before the child is born. The issue of nutrition. We know that when a mother lacks calcium, for example, and she's pregnant and this child is growing, if she does not have enough calcium, the calcium from the mother, whether it is from the bone or whether it's from the teeth, will actually be reabsorbed and will go to the child. And this will make the mother now have a problem of bone density, and the bones can easily break down. The teeth will be affected. So even the nutrition of the mother is very important even before the child is born. What the mother does in terms of physical activity, this will enhance the blood circulation or will reduce it, and it also have an effect to the child. What the mother uses, substance abuse, for example, smoking has been shown to reduce even the brain of the child. The child will be born with a small brain, with a small head. We know alcohol has been shown that has negative effect to the child. We know there are certain drugs, when they're used, they might even be medicinal substances like diabetes drugs, whether they're hypertensive drugs. When they are used during pregnancy, some of them can actually cause abnormality into the child. If a mother's nutrition, for example, she lacks folate and iron, we know that folate actually can cause neurological problem. That is, the nerves can have problem, the brain can have problem of this child. The spinal cord can actually be born open. The condition will cause spinal bifida because the folate is not enough. So even the nutrition of this mother is very important. The way this mother communicates, whether she's depressed, whether she's annoyed, whether she's happy, there are hormones during this time that actually circulate internally in the mother's body, which actually can pass through the umbilical cord to the child. And this can actually also affect the child negatively. So the things the mother does, the things the mother takes, how the mother interacts, actually also affect the child. So the child health starts being affected inside the womb, inside the stomach of the mother, before the child is actually born. So it's very important that even the mother, what she does is important so that it does not affect the child. Once the child is born, there are several things that needs to be done correctly so that we can enhance the health of this child. One of the major things is the issue of immunization. The child needs to be immunized against preventable diseases. We know the many diseases that can be prevented by immunization, and these, for us, they are given, there is a routine of a schedule of what they're given, so that as they grow, they do not get this disease. So it's very important for them to get this immunization. We know from birth up to 5 years, a child should be taken to the clinic, should be taken to the health facility to be followed up so that they can check the development in terms of physical growth. They can check the development in terms of mental growth so that they can see that the child is growing as expected. And if there are any deviation, the child can be attended early enough so that it can be corrected. We know during this growth, there are other elements. For example, the physical health of this child needs to be actually followed up, assessed, evaluated, so that once there are abnormality, for example, we know that there are children who are born with feet that are curved the wrong way, equinovarus, and this can actually be corrected very early. And once it is left without being corrected, it can give a permanent deformity to this child. So these things that are gotten early in this child can actually be corrected. As the child grows into adolescent, into adulthood, there are several screening that actually can supposed to be followed up. And we know, for example, for the girls, once they get into sexual activity, there are issues like cervical cancer, they need to be checked. There are, once people are around 40 years, we know for the men, we need to check them for prostatic cancer. So there are several screenings that actually during different stages of the life that needs to be checked so that this person can have a healthy lifestyle. Then, as the person is growing, what are these interactions, this child that needs to be actually nurtured so that this child can fit into the society, can fit into the community, and can be a healthy being so that he can contribute well, not just to himself, to the family, but to the nation. And these include issues to do with cognitive issues. It needs to do, issues to do with education, issues to do with upbringing in terms of relations, in terms of relating to other people, so that this person, this child can fit at home, can fit well in school, and can fit well into the society. So these are some of the elements in a child that are very important so that it can have a healthy lifestyle. And also to look at the physical needs of this child, the nutrition of this child. This child needs also to be encouraged to play. This child needs encouraged to interact with other people so that it can experience, can learn from the other children. The spiritual aspect of this child is also very important to be brought from early stages so that this person grows knowing that there is something to hold on, there is a reason for us to live, and the positive aspect that this spiritual aspect actually have on the health of this child. Then the social interaction. This child needs to be trained from early that there are issues to do with sharing, there are issues to do with actually appreciating other people, there are issues to do with loving other people, and the most so, the parents needed to bring out this positive aspect because children learn from what we do. They do not do what we tell them most of the time. So we need to be good example to our children so that we do what they want, we expect them to do. We are attending, for example, we are going to the masjid so that they can look at that as a positive thing and they can follow. So that these are things that they can emulate, have good peers and things that they can follow. One of the main problems with our children currently is that they lack the guidance from us parents, from the society. Then they go to other things to get this guidance, whether it is from the social media, whether it is from their peers, and sometimes by trial and error. And also, now most of the children are going to drug substance abuse, which actually it's because they lack that guidance. They lack something to hold on. They lack people to go back. And we know that substance currently have become it's a big problem in the society, and it needs guidance from all of us, and we need to take care of this. Children need our guidance, and for us to have this in totality, we need to be informed, we need to adhere to Islamic teachings, and more so know what are these simple things that we need to do so that we can be healthy. So we'll also be going to be talking about how do we plan to have a healthy lifestyle. And having a plan, a healthy lifestyle, is knowing what you need to do, how you need to plan for it, and the gentle interaction between you and our fellow people. Shukran for being with us. Today, this is the end of our current program, and we'll appreciate you to be joining us in our subsequent programs.
كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه